Good morning, Lake Providence Church family and friends. This is Dr. Linda Plummer Ward with another health ministry update. Thank you so much for joining me today. So, last week, Davidson County began vaccinating K through 12 teachers and staff, preschool teachers and staff, and other first responders that are in staffing and administration. This is phase 1B now, and we're vaccinating residents age 65 and over. Vaccine appointments can be made by calling 615-862-7777 from 7 a.m. to 7 p.m. You may also visit COVID-19.nashville.gov. Vaccines are available from multiple locations now, including the Music City Center, Meharry, Matthew Walker, Vanderbilt, the VA, Walmart, and multiple other areas, including the local clinics. But remember, an appointment is required. The VA is vaccinating veterans age 55 and over right now. And Walmart on Charlotte is in the midst of a 5-day vaccine marathon that started on either Friday or Saturday. Call them for more information. Unfortunately, over 500,000 of us have died in this country from COVID-19. Although our numbers in many of our metrics continue to improve, the death rate is still rising. There are over 2,000 cases of the UK variant in the United States now. The other variants, fortunately, are not moving quite as fast, and we're a little more concerned about them than we are the UK variant. But they are all here. Past experience shows us that vaccination, herd immunity, all of this slows the spread of the disease, stops severe disease, hospitalizations, and death. And that's what we're trying to do now. The more of us that get vaccinated, the more of us that the virus will not have available to use as host, which means that it's going to start to slow down. It's going to not have anybody to infect. That means that we can get back to some form of normalcy sooner. Israel began its vaccination program in December. And guess what? They have vaccinated over 84% of patients who are 70 years of age or more, and 20% of those who are 50 or less. And they've shown a 67% decrease in the ratio, and they were using the ratio of persons who were 70 and over who would require ventilation and persons who were 50 or less that would require ventilation. And the ratio was like 5.9 to 1. It's now 1.9 to 1. That's impressive. This is real life proof that vaccination works to mitigate or slow the spread of COVID-19. Continued studies indicate that the vaccines may stop transmission. We don't know that absolutely yet, but they're working on studies to produce the data to show that that is going to be the case. It's believed that our public health measures have done something else. So our washing our hands and wearing a mask and watching our distance helped with COVID-19, but it also made us not have a flu season this year. And not just the United States, but that's around the world. That's the first time in years. That's also impressive. Now we just need to get herd immunity for this COVID-19 and make it go away. There is a third vaccine that is presently being reviewed by the FDA for emergency use authorization, and that's the Johnson & Johnson vaccine. It doesn't use the mRNA technology that Pfizer and Moderna used. Instead, it uses a human adenovirus to get the information into our cells to start the immune reaction. It uses only one injection instead of two. So one shot, and it seems that shot actually gets better over time. The immunity improves over time. Its efficacy against the South African variant was also proven because it was tested in South Africa. So we know that it works against that variant, and that's one of the ones that we're concerned about. It can tolerate regular refrigeration, and it's cheaper. And these are all great things. It may be that this is one of the vaccines that we can use for third world countries because people won't have to follow up for a second shot, and it can be taken where it needs to go without worrying about freezing it. So that's going to be very good for the rest of the world too. Remember now, whether you're vaccinated or not, right now, we're going to continue to wear a mask, wash our hands, watch our distance, avoid crowds, and increase ventilation when we can. Have a blessed week. Stay safe, stay healthy, and stay prayed up.